Good morning. My name's Professor Prince. I'm a haematologist here at Epworth Healthcare, and I'm a co-founder of Snowdome. Today I'm going to give you yet another update on where we are with the coronavirus, COVID-19, particularly for patients with blood cancers. So I thought, when I was thinking about this, I thought, well, what's changed? And I think what we've learnt is we've got a lot of experience, both here and around the world, as to who are the patients at risk. And I think it's fair to say that compared to where we sat in March and April, where we really were worried about patients, particular types and subgroups of patients, blood cancer patients have been looking after themselves. They've been avoiding and social distancing and following instructions about being at home. And that, I think, has reduced the exposure and the number of patients with blood cancers. In fact, around the world, there's been relatively very few patients. For example, in Australia, there's been less than 4 patients with myeloma that have been recognised to have significant COVID-19 infections. Now, the reasons behind that are probably, first of all, people have been looking after themselves and being aware of social distancing and knowing that they are potentially at risk. Secondly, however, it stands out that the major risk factors for significant infections are age, particularly over the age of 80, obesity, renal impairment or kidney dysfunction, high blood pressure, and other morbidities such as not being able to move around. So people with Parkinson's disease, for example, have recently been recognised to be at higher risk, and that's because it's harder for them to shake off infections because they can't move around. And you could apply that to a number of other conditions where people are relatively immobile. So I think the first thing to say is that no need to be overly scared, overly paranoid. Follow the same instructions that we're being told about. So, have we been able to predict the future appropriately over this? And I have to say that I've been wrong on a number of occasions. And the 2 real occasions where I was wrong, one was back in June, I was predicting a second wave, and I was saying to this audience that we could get up to 200 or so people per day. Well, I was wrong. It got up to 750 people per day in Victoria, and that shows how quickly this can move. And the reason that it can move so quickly is we know it is a highly infectious virus, and once the wave starts going, it's very hard to stop. So how do you stop that wave? The way to stop the wave is to have very good contact testing and tracing. If you're worried, go out and be tested. New South Wales is going to be, in the future, recognised as have reached a major achievement. They're going to be internationally recognised in what they've been able to do in terms of contact tracing and testing. And that is because they have a very good public health system. I think this is what is going to be critically important for Victoria to avoid a subsequent third wave. Einstein once said, the definition of stupidity is doing the same thing over and over again and expecting a different outcome. So what does Victoria have to do differently? Victoria has to make sure that people are being tested, that there's good contact tracing, and that we can follow up on things very quickly. And so hopefully that will happen. But if it doesn't, if for some reason the Victorian Department of Health at DHHS hasn't quite got it right and we're slow and reporting, then we could face a third wave. And I think that's the biggest risk. So what does that mean to you? Well, that means as soon as it's allowed to start moving around, visiting your families, please go and do it. Go and see people, social distancing, wearing a mask, but what we're finding is that the burden of this second wave psychologically has been high. And so you need to not put it off, you need to say, organise, go and see your family, perhaps go out to dinner, get together with a few friends and enjoy that time. I hope I'm wrong and that we don't have a third wave. I hope that we are able to do what New South Wales is doing, which is keeping the numbers down low and people are getting back on with life. But if it doesn't, we're going to face lockdown again. Please enjoy the time that we have, and hopefully it will keep going through to Christmas and beyond. As long as people are doing the right thing, which is wearing a mask, really stick to social distancing, be aware of the bubble, that it is a very easy infection to get. I mentioned last time, one of the important things is have your bushfire plan, or what I mean, your COVID plan, so that if you do get a contact and you hear from somebody saying a friend or your children or somebody who is in your family is at risk of having been exposed to COVID, how do you isolate in your own home? And so you get the call from your son, and Mark's been sitting next to James, who's been diagnosed with COVID, and Mark's now on his way home. What are you going to do? So it's very easy. The DHHS will help you, but basically it's about rapid testing. It's much easier now, but you're going to have to do social distancing with your own home, and everyone has a different situation. So just think about it, and you'll be okay. So what do you do in the next few weeks? Well, enjoy yourself, wear your mask, follow instructions, social distancing. For those of you who are at risk of flu, it is time for your second flu booster. We haven't eradicated flu completely. Go out and have your flu injection, and just enjoy life. Recognise that blood cancer patients are at risk, but we've learned that it isn't an enormous risk. And so you should see yourself as being another member of the happy public working our way through this COVID. Last of all, vaccines are happening. I'm very optimistic about what's going to happen with the vaccine. We are going to get through this. My guess, and I hope I'm right, is that we'll be vaccinating by the end of the first quarter of next year, and we hope we have a good vaccine.